Hello, everyone. This is Doug Nelson with Precision Neuromuscular Therapy. I wanted to take a moment to just go over some of the anatomy that might be helpful for you to review before you attend the TMJ Intensive. In our TMJ Intensive, we're really going to be dealing with this area of myogenous dysfunction in TMD. And that is by far the most common reason for temporomandibular joint dysfunction. There are arthrogenous changes, but those actually are much smaller in number compared to the number of people who struggle with TMD, and the source of that is ultimately the soft tissue. So TMD is really multifactorial. All of these things can all have an effect on it. The thing is, with soft tissue, it's something that we can really do something about. And one of the reasons that we as an organization and that Sarah Lashley and myself and my office love working with this is that the soft tissue component of TMD is often very much overlooked. And I think you will find the same thing in your own practice, especially the more familiar you get with and more comfortable you get with the treatment. I think you're going to find there are a lot of people out there who struggle with this, people that you didn't even know. So that's been our experience, and I'm sure it will be yours as well. So one of the things that you need to do, just a little review of the bony landmarks. Make sure you're familiar, again, with the coronoid, the condyle, and the articular eminence. All of these things are going to be important as we start to review discal anatomy, especially. So this shows you a little bit of the disc, and we're going to spend a fair amount of time going over the kinematics of the disc, how that works, and how soft tissue dysfunction plays a role in that. We'll spend a fair amount of time in this. So just make sure you're comfortable with the anatomy of that area. In terms of muscular stuff, first, in just the superficial tissue, the occipitalis, the frontalis, this whole epicranial aponeurosis, it's really important not to underestimate the importance of that in TMD dysfunction. It shouldn't be overstated, but it shouldn't be understated as well. And then, of course, in the layer below that, we're going to spend a fair amount of time with the temporalis and its various sections and influences on the movement of the mandible, and also the masseter. And of course, there are two sections to the masseter, a superficial section and the deeper section. Each one of them has their own symptom presentation, and the way you access it is actually quite different. So make sure you're comfortable with that anatomy. Also, the pterygoids, the lateral and medial pterygoid. Here's a picture of the upper section of the lateral pterygoid, and here is the lower section of the lateral pterygoid. This is the medial pterygoid below that, which is a often overlooked and very, very strong closer of the jaw, and has its own set of symptoms. So there are three major closures of the jaw. That is the temporalis, the masseter, and the third is the medial pterygoid. This also has importance in limiting lateral protrusion. So we're not only interested in inner incisal opening, how far someone can open the jaw, but also their ability to shift from side to side. We will spend a little bit of time with some superficial neck muscles, because there is a really interesting relationship between the TMJ function and also the cervical component in this bidirectional feedback loop. So we'll spend a little bit of time with the platysma and also spend time with the supra and infrahyoids. So again, review that anatomy and just make sure you're familiar with things like the geniohyoid, hyoglossus, mylohyoid, stylohyoid, digastric, omohyoid, sternohyoid, and sternothyroid muscles, all of which can play a role. And then lastly, something that most of us aren't that familiar with, and that is the glossus complex, the styloglossus and hyoglossus in particular. So review the anatomy of the tongue, because we will be spending a little bit of time. So again, we're going to spend a lot of time with the anatomy in class, but the more familiar with you are before you come, I think it'll make the experience even deeper and richer. Thank you so much for taking the time to view this, and we'll see you at the seminar.